Hello everyone, we are at ICM 2025 right now and I am with Dr. Murat Bozkurt. Welcome.
Thank you. It's really nice to meet you here at this, the booth here. I'm really happy to talk with you.
Okay, I'm happy to talk with you too. Okay, right now I want to ask you, could you please introduce yourself for our audience?
I'm Murat Bozkurt. I'm working in Ankara, the capital of Turkey, not in Istanbul. I'm working in Ankara Acıbadem Hospital. I'm the orthopedic professor, and my main subject is arthroscopy and arthroplasty. That's why I'm here, because I'm also doing lots of, the knee and hip revisions. Now I'm here for the, ICM.
Okay. As I think our followers already knows this, but I also you have the art school, so you want to mention about it a little bit?
Yeah, actually, art school history just, goes to the, before the 2010, and actually we organized this art school as a web-based education system. Now also some caloric courses and some meetings as well. Now I think art school has more than 20,000 members from all over the world. And we are organizing some webinars, we are organizing caliber courses, some meetings, actually, and also we have a really good website, and people can visit our website and can see some anatomical dissections and the case discussions, different topics. They can follow about all the musculoskeletal system problems, some basic sciences and clinical sciences as well.
Okay, thank you. My question will be about the infection. Why does the infection matters for you?
Infection is nightmare for all of us, and it's just if I say that one word, is a nightmare. Of course, every time we are afraid about the infection after arthroplasty, even the other surgeries as well. Actually, that's why we are here. And then I think the most important thing for the infection is prevention. And then if there is, also we have to treat the infection. That's why we are here with the ICM to discuss the details, our experiences, and what the literature says, and what is the clinical evidence of the different subjects. We are discussing.
Okay. When we're talking about the ICM, I want to ask you, what's ICM mean to you?
ICM means for me really superior and different approach to the discussing some topics. It's really important because this is highly scientific, the discussion, and of course we are just reaching the correct knowledge for some really important questions. That's why ICM approaches and the systems and the setup is really critical for me to just adopt another subject as all these things.
I'm sure you attended so many meetings and congress. So what is the difference of ICM compared to other congress and meetings?
Actually, ICM philosophy is completely different than the others, because we are in ICM, we are just trying to reach the correct answer for the really important questions, because always we are facing some problems during the operations when we are treating or when we are examining patient. In ICM, subject is nightmare, as I said before, and then for the nightmare we are trying to find a solution, and ICM is really important. After all the documents will be published, we are just reading, and then we are treating, or we are getting some lab tests according to ICM's outputs.
At the end of the interview, is there anything you want to say about your feeling or your thoughts about ICM?
I love ICM. And then also, I have to say, Professor Parvizi is the father of ICM. That's why I really appreciate, the Professor Parvizi to show all this setup to us. Of course, I have to say the Torsten Gerke, because they just organized all these organization almost 10 years ago, and I also joined in Philadelphia to do, the second ICM. Actually, now much more people from the more countries than the others. Now this, really good expansion, and they're getting some really, the huge populations, opinions, and with the scientific evidence papers.
You already answered all my questions, so thank you for your time. Thank you to be here.
Thank you. It's great pleasure to be here.
Okay, thank you so much.
Nasıl oldu?